So, hi Anjani ji, welcome to Love is
Yeah,
Cancer and Zan IO. This is a
thank
cancer
you.
healing journey talks where we invite speakers who have gone through cancer, maybe as patients, caregivers, or warriors like you who have been through this journey, came out beautifully, and now sharing their journey to inspire other cancer patients and caregivers going through a similar journey. So, thank you so much for joining us. It's an honor to have you with us.
It's my pleasure.
Yeah.
Uh, I'm Anjani Kumar. Like I'm studying. I'm at 24 years old now, and I'm pursuing with my MTech in Andhra University, Visakhapatnam. So in 2014, when I was about to join in BTech, one day, like I was about to eat a pizza, and eating pizza, I had a nose bleeding. So suddenly it started and it again stopped, and we thought that it was a just normal thing, and it will not a severe issue. So then we thought after a year, like after a few months, it was started like a pain behind the ear. So I was not able to open my mouth completely to eat, and I thought that it was a dental problem or orthopedic problem. I went to the both of the doctors, but they said this is not the dental problem, dentist said, and orthopedic surgeon said it was not the orthopedic problem. It is related to ENT. So I visited all the top doctors in the Visakhapatnam ENT doctors, and none of them said that it was a like a cancer somewhat. None of the symptoms were diagnosed, like shown. So since childhood, I have a sinus problem. So each and every doctor thought that it was a sinus, and one doctor actually he performed a sinus surgery. It's called a functional endoscopic sinus surgery, and he stopped that surgery in the middle. And during the surgery, he found a huge mass behind the nose. So, with fear, he stopped the surgery in the middle, and he sent that biopsy to the biopsy and waiting for that report. So, in 2015 April, the biopsy report claimed that in Visakhapatnam it was not such a like tumor and all, but I lost trust in the Visakhapatnam doctors and all, so I shifted to Hyderabad for the further diagnostics, and there I was diagnosed that it was a fourth stage of nasopharyngeal carcinoma, and doctors said only one thing, that uh, you need to eat food. I can save your life, I can trust you that, but only thing you need to do is you have to eat a lot of food, and eat and drink lot of water. So I said, I and my parents don't have any awareness regarding this at that time. So it's a small thing. Regularly, I'm eating food. Why can't I do that from now to the 3 months, post 3 months? So I started eating regularly and all, but they started chemotherapy, and after chemotherapy, they gave radiation and all. By in radiation, I lost my saliva. Like saliva production has been very low, and everything like the complete eyes to the throat part, it's completely dead. Like for eyes, the side effects like cataract, I have the cataract now, and for nose in winter season, I especially like it will bleed. Like there's nothing particular time, even while writing exams, my nose will bleed frequently. So couldn't say that what time it will be and what it is. And saliva, there won't be any saliva for me because of radiation side effects. And I was affected with thyroid because thyroid glands are in the throat. So, and I have a severe dental problem. Like I underwent with almost all 20 root canals, 20 teeth, for 20 teeth, I went to root canals, and I'm left with four teeth root extraction. So this is the complete, like I went to these problems, and after the treatment, I had severe problems with the educational. Like they gave me a year break, and after that I went to that problems, and after that I like this I don't know, like this will happen, like this will be the part of the treatment and all. So I started like I faced that this I came through all these things. This should be happen to all those who are coming through this. So I started giving awareness to all the cancer patients and all in the Hyderabad hospital. And I joined in one NGO which is based on cancer treatment, like Asya Foundation. And I didn't like that because it's like some issues we have, like I have with that NGO. And I started my own NGO like Taksha Foundation, and I'm helping all the cancer patients here, like financially and emotionally. I'm helping all the cancer patients whom I know in my context, though it's a small amount, but I'm helping here. And I'm helping all the poor and needy people and all the school students, and promoting the awareness regarding the cancer and all. So this is all about me. And this will be a, but once one time I get thoughts like why this all happened to me, because I never touched the cigarette, I never touched the alcohol, I never tasted a single drop of alcohol. Why it happened to me? But sometimes I get thought that it was the best part of my life, because this was the real part where I know what I am, and I know what's my power. Like I can face anything in my life, and anything I could face, any problem. Okay, fine. What's there in that? Okay, fine. I can go with this. So sometimes I get thought like this.
Yeah,
Yes.
so like cancer has made you look within.
Yeah, yeah, yeah.
Yeah. So it was oral cancer, right?
Yeah, it's basically started behind the nose, it spreaded to the
Hmm.
ear and spreaded till the throat.
Okay.
If it's a 1 or 2 day, if the treatment was 1 or 2 days delay, it would affect it to the brain and the spinal cord also.
Oh,
So at that,
so it was at advanced stage?
yeah, final stage.
Okay. So what were your side effects during the treatment?
During the treatment, like sore throat, I could not able to eat any kind of food. Like I survived on only glucose water for 1 month. Only glucose water. So nothing. So I could not able to drink anything, like anything. Only glucose water, which is sweet. That gives me energy. And sore throat, the first thing. And the second thing, my eyes got affected. Like
Hmm.
the one part of the cornea was broken off, and later then they attached it, like
Okay.
a scar in my cornea. Sorry, my language is not so good.
No, 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 that's okay. I can understand.
Yeah, a
Yeah.
small scar in my I think right eye, a small
Hmm.
scar, so that I could not able to see. I could not open my eye that at that time. And the complete face is like a burn situation. Like my complete face turned into black, like the skin tearing off, the skin is coming off, and the blood will be coming from that, hair loss. And that's it. Saliva will be there, but at the end of the treatment, the saliva will be stopped completely. The
Okay.
production will not be there. So, and side effects, like after post radiation, after 1 or 2 years, I was affected with thyroid. Present I have thyroid, hypothyroid, and cataract. Since I was treated with the face and the throat, I was affected with cataract.
Okay.
So,
Hmm.
and dental also there will be a problem. And I came to know that in the radiation there will be two kinds of side effects for saliva only. one, either it will stop
Okay.
completely or it will give a double production. So
Okay.
one of the patient I have interacted with the same diagnosis. Mine is the final stage,
Hmm.
and that person is the second stage. The same treatment.
Hmm.
He got the double saliva production instead of stopping completely. So
Okay.
symptoms depend on the body also, like how it is responding and what's the stage is also.
Yeah.
And the food pipe got narrowed. So since 5 years, I'm not able to eat any kind of food from 2015. So I'm on the liquid diet, and present now, uh, ga- gastroenterologist doing esophagus stricture dilatation. Like they'll send the endoscopic wire through the throat. They'll blow the like they'll blow it and they'll expand the food pipe so that we can able to eat soft food. But this is for temporary only, like it is enough for one time, but in my case there is no saliva. So again, if opening also, then it's again completely closing. So it gets that the dilatation is getting repeated many times, like till now, from November 2018 till now, and I went with 18 esophagus stricture dilatations, like 18 times underwent. Since this will be completely sensitive part, they gave me a general anesthesia and doing all the procedures thing. That's it.
Okay. So with all these physical things going around, how you manage your emotional wellness?
Emotional wellness, sometimes till now also I'm not able to come up, because some point of time, like I'll be getting thoughts, why happened to me only, like what did I do a mistake. uh, I'm not able to I'm not able to come up with this all these problems. Till how many years still I need to face this all? Like if dental touches the dental part, that if anything goes wrong, the nose will get affected. Like nose bleeding starts. So if eye problem, if any ophthalmologist touches eye, then nose bleeds. So in especially in this winter time, I'll be getting all this loss, because nose bleeds frequently in the winter time only. So still now I'm fighting with that emotional thing.
Yeah, but still you are helping other cancer patients in their
Yeah,
journey.
yeah. I'm just, if anything is, I have a bad habit. Like I'm not sure that whether it's a bad or good, but I have a habit. Like if anything is goes wrong, I'll divert my mind into something, like
Okay.
playing keyboard or listening to music or helping these people or some other thing. I'll divert my mind into that, so that I couldn't get these thoughts. I won't get this like these thoughts, negative thoughts. So that's it.
Yeah.
That's it.
Yeah. So like it's very courageous of you that you are in that space, that you are still coming out of it, but then too you are helping other patients
Yeah,
in their journey.
yeah,
So heads off to you.
yeah. Like my motto is like only one thing. No other patient should face like should be in my place. Like they need to be happy. They need to be okay financially. Because my father, like took care everything financially. Like he didn't step
Hmm.
backward. If he stepped backward, then my life would be in risk now. So this position, this will not every position, not every family will be having this kind of position. So some may be financially poor, some may be financially rich. So if they are financially poor, then I'm helping them. That's all.
Yeah. So what was the support system during the treatment?
Support system, like sorry, I didn't get, can you repeat it?
Like what was the support system, like family, friends, relatives, doctors?
Only
So what was your support system?
only my parents, I can say, because my father supported. He was the motivation. Like uh, he used to say only three words like accept the situation. Whatever the situation, you can't go back or you can't go front. The present situation, you need to accept it. If you couldn't accept it, everything would be negative. Like if you accept it, okay, fine, the situation is this, okay, you can deal with it. And he used to say only one thing: for every problem there will be one solution. The solution, you need to find it in your life. For any problem there will be one solution, because he used to give an example: when sun rises, the sun will be sunset also. And the day, if in complete 24 hours there will be day, there will be night. Think that problem is your night and find the solution as your day. Then everything will be like uh, easy in life. You'll be happy every moment in life. This kind of difficulties you'll face in life, but uh, search for your solution where you have the solution. If it gets early, then everything will be fine. If it gets late, then you need to face a more pain. That's it.
Yeah, what a beautiful example.
Yeah.
Yeah. So, any special diet changes? Like what you are only on liquid diet. So, what specially you
Present
take in that?
present, I'm able to eat some of the rice, only carbohydrates I'm eating.
Hmm.
And doctor, like my oncologist suggested to eat oats, cornflakes, which is a high source of protein.
Hmm.
Like you can idli, upma, and
Hmm.
all that. All it will be helpful to you. And it is after radiation, it is like it will be more comfortable to eat for a patient,
Hmm.
like rather than eating dosa or any other kind of food hard.
Yeah.
This idli will be soft, it will not be anything spicy. And upma also, like it will be soft, no, nothing spicy. And for saliva produce, I mean saliva generation, they say that to take vitamin C, vitamin
Okay.
C. And used to chew sugarless chewing gums.
Okay.
uh, and dentists say that to clean my mouth every time,
Hmm.
whatever we eat, whatever you drink, like we need to clean our mouth, because after radiation there will be no saliva.
Hmm.
And if there is no saliva, there are more chances to form a tooth decay very fastly, I mean very quickly. So we need to clean our mouth so that no minor food particles will be there in our mouth. So that is the main thing. And in winter season, we need to keep our nose, eyes, and everything dry. Like sorry, wet.
Okay.
For nose, we can use Nasoclear gel or drops,
Hmm.
saline drops. And for eyes, we need to use refreshed ear drops.
Hmm.
They suggested these only. And for vitamin C, zincovit syrup or any kind of like natural, they suggested me natural ways like orange, lemon,
Hmm.
etc., like this kind of. And that's it.
Yeah.
And
Okay.
for dental, they said to use mouthwash and
Okay.
fluoride toothpaste. That's it.
Okay. So even after cancer, you are going through many side effects. So that
Yeah,
might be very frustrating for you sometimes, but still you are not giving up. That's the main
yeah,
thing. So what
yeah.
is the thing that keeps you going?
uh, I always stick on one thing till now.
Hmm.
In life, I didn't do any kind of mistake. Like
Yeah.
I said previously, like I didn't touch a cigarette or didn't touch alcohol. So why I need to give up? If there's no my mistake, then why I need to give up?
Hmm.
If suppose I did a mistake in exam, or I got caught while cheating my exam, then I can give up the exam because I had a mistake. But here I didn't have any kind of mistake. Then why I need to give up? Let's fight for it, because fighting for back is the most thing which every patient needs. If I smoke a cigar or I drank alcohol too much and I affected by that, then I can give up my life because there's my kind of mistake also. That's it.
Wow. Yeah. So you are not ready to give up in any condition.
No, no. Any condition, any problem, I'm ready to face. That's it.
Wow. Wonderful.
Thank
So yeah, you said whenever you feel low, you try to divert your mind.
Yeah.
So what are the things that makes you happy?
Uh, Listening to music because listening to
Mhm.
pleasant music that refreshes my mind, or straight away I'll switch off everything. I'll sleep it off because uh, I tried yoga, but the main problem is when I breathe in, like I have a nose bleeding, so I cannot perform any
Okay.
kind of breathing exercises and all.
Okay.
So I'll completely switch off and I'll sleep it in a room, in a closet. That's it.
Okay. So sleeping makes you happy.
Or I'll go out a ride to the beach.
Okay.
I'll
Wow.
sit alone and drink a small cup of coffee there. That's it.
Wow. So what will be your message for cancer patients and their caregivers?
My message is only one thing. Uh, Accept the situation first. Search for a solution. The 3 points I said that accept the first point is accept the situation. The second
Hmm.
point is search for the solution, and third point, if you have both, then you need to fight back. That's it. The three
Yeah.
things.
Wow.
Every patient needs to remember these three things only: accept the situation, search for the solution, and fight back. That's it.
Yeah. You are already halfway done when you accept the situation.
Yeah.
Yeah. So what are your thoughts on the work and help Zen Oncologist IO and Lovel's Cancer are doing?
uh, the, it's a very nice initiative so that every patient will, like, it will gather like a community, like cancer patient survivors, warriors and all. It will be a best community, and if every people in that community works together, they can make a huge change in the country, I can, in the world, we can say.
Wow.
Like they can change so many people, they can give life to many people, they can inspire many people, they can motivate many people, and they can do anything because the cancer fighting is itself a impossible thing, but they came out of that impossible thing. They can do anything, they can change the world.
Yeah. So you help cancer patients now.
Yeah.
So you might have experienced do you have any such experience that touched your heart? Any story of cancer patients that touched your heart and motivated you?
Yeah, during my treatment, one day, like I was getting for chemotherapy, and beside my chair, beside my bed, like one, I had met one child. He was 6 years or 8 years old, maybe.
Hmm.
Like he was facing with the cancer, the tumor behind the eye. So he's studying first standard, and I spoke with him like, what are you doing, what happened in your life and all. So he said, I have a pain behind my eye, but doctors have told me that it will be get cured only when I eat some good food, good and healthy food. Okay, nice. What you inspired the doctor? Like I was asking him, what you like in the doctor and all. He gave me the confidence. One thing he said, the doctor gave him the confidence. That's it. I was really like, at that time I don't have any kind of awareness or anything, but talking with that child, like I was inspired. Even I was an 8-year-old child is fighting with the cancer, then why am I unable to, like, I can't fight it back. then I started to fight back with it.
Wow,
That's it.
wonderful. So it
Thank you.
was really, really very inspiring talking to you. Such an
Thank you.
inspiration you are. So
Thank you.
thank you so much for sharing your journey, and I'm sure that the way I am inspired, many people will be inspired too.
Thank you so much. It's my pleasure also, and thanks for giving the opportunity.